to the Your Health television program on Access Monterey Peninsula's cable television channel 24. You can also see us on the web at ampmedia.org. I'm your host, Dr. Edward Westbrook, and today grab a piece of paper and a pencil, and hopefully you'll get some great information to improve your overall health and well-being. And to start off, we're going to have my first guest, who's Mr. Edward Pio. He's the founder and executive director of the International Institute of Medical Hypnosis. He's also the creator of a home study self-hypnosis course, and he's been teaching medical and self-hypnosis to health professionals and groups for 46 years. He has 35,000 students that have taken his courses in various forms, and he's actually done this internationally, Russia and China. So please help me welcome Edward.
It's nice to be here.
Nice to have you here.
Thank you.
That's quite a history there.
Well, I've been around for a while.
You've been around?
Hopefully I don't look that. People said, "Are you kidding? You've been doing one thing for 46 years."
That's a long time.
Yes, it is.
And I'm 45. So yeah, you've been doing longer than I've been alive. That is a while.
Well, I won't fault you for that.
Okay, good. Well, you're aging well. That's good.
Thank you.
So let's start off. There's a lot of information about the types of hypnosis out there. There's medical hypnosis, self-hypnosis, there's meditation, there's the hypnosis we see in circus acts, there's all these different forms. Maybe we can start off by just having you delineate and kind of differentiate these types of
I'm happy to, because it's a lot of misinformation is put out there. There's a lot of philosophies connected with different meditations. There's a lot of wrong information connected with medical hypnosis or hypnosis. Basically, all of those forms describe different ways of focusing the mind. So we're not talking about something that's crazy far out that you have to go somewhere into an ashram or whatever to learn over a period of months. This is something that can be learned more easily than learning to walk, and probably more easily than learning to talk. The first thing that has to happen is people have to understand, what is this? Is this something that makes you bark like a dog, like the stage shows? Is it something that you have to go off and work on for a long, long time? And the answer to that is, all human beings are able to focus their mind, with a very few exceptions of the lower IQ and physically disabled. Other than that, everybody can do it. So the question is, what is involved in focusing the mind? And if you don't mind, I'll just continue with it. We all focus the mind in order to go to sleep. I don't know whether you ever think about that or not, but no one goes into unconscious sleep without focusing their mind to some extent on the way to getting there.
Okay. So you're actually saying all of these, what they have in common is the focusing of the mind.
It is the focusing, yes.
That's what they have in common.
That's what the common thing is.
And what's the difference then?
Well, the difference is hypnosis, all forms of hypnosis, whether we call it medical hypnosis or whether we call it self-hypnosis or whatever, is closer to a focus that leads us into sleep. In other words, in order to go to sleep, what we have to do is focus on something fairly pleasant, or at least one thing. You can't have your mind going in 50 different directions and ever hope to go to sleep. So in hypnosis, what we do is give you essentially what to focus on, and if you cooperate and focus on it, you essentially head on the path to sleep. And then it's up to us as hypnotists to stop you from going into unconscious sleep.
Okay.
And so we call it sleep. In other words, your mind and body move toward sleep or unconsciousness, and the hypnotist stops you just before that time. And most of the time that's either in lower alpha or theta brainwave state where that actually happens. In the forms of meditation, the difference is that you're still putting the body to sleep, but you're keeping the mind awake. So you're keeping the mind active versus hypnosis, where you are essentially putting the mind to sleep. So any process that makes you focus to the degree that your mind stays awake, and measurably so in deep meditation, for example, you're more awake or more aware than you are in the normal waking state, like you and I are in at this present time. Hypnosis is the opposite. Hypnosis says, oh, I feel wonderful. It's been kind of like a lazy way of getting into those altered states. Okay, so deep meditation is not as complicated as it seems. It just requires you to work instead of being lazy. That's what it comes down to.
So now you mentioned that everybody needs something, that the hypnotist gives the person something to focus on. Is that the same thing for everybody, or is it differs?
No, I'm sure that there's an infinite number of ways. I use a way, because I have claimed for a good number of my 46 years that everybody can be hypnotized. That's number one. And everybody can be a hypnotist. That's number two, because there's a lot of hypnotists out there that somehow developed the idea that they were gifted, sort of like a psychic is gifted with this. They were born with this. Well, it's not true. Anybody can be a hypnotist. And essentially what I've been doing, is, other than the meditation part, has been teaching people how to be their own hypnotist and teaching them how to do the programming once they get into that focused state. And it's much more effective than somebody from the outside doing it. Because, you know, if I start to program you for stop smoking or whatever, and you really don't want to stop, or you don't want to make the change, and you can pay me a lot of money to do a session, but that doesn't mean that it's going to work. There's a great number of factors involved in it. So now medical hypnosis, to give you a little bit of a difference, the normal hypnotherapist for smoking and weight and those types of things usually don't take their clients into a theta brainwave. They usually do it into a relaxed state, somewhere in the alpha brainwave state, where they're susceptible somewhat to suggestion. But in the theta brainwave state, then you can give suggestions like anesthetic suggestions, and you could have a major operation. So let's say someone was allergic to all of the different forms of anesthetic, and so the only thing left, they'll say they had to have a major surgery, is you could do it by focusing the mind into a theta brainwave state and accepting the concept or the idea or the program that your abdominal area is numb and cold and insensitive to feeling, for example, which would then allow the surgeon to go in while the person is essentially still awake. And so the hypnotist would have to be there, as if the hypnotist was in fact the anesthesiologist.
I see.
So that's the difference in it. It's not you either can do that, or you can stop bleeding, or you can increase circulation, or you can do all of those things in the theta brainwave state, which requires generally more time to get to than, quote, the normal therapeutic hypnosis.
So these different states, you mentioned there's the alpha state, which comes before the theta.
Right.
How many states are there?
Well, number one, brainwaves are kind of interesting because we have two hemispheres in our brains, the left hemisphere and the right hemisphere, and I sort of teach on the basis to think of those hemispheres as computers. So anyone who knows a little bit, at least about computer, can associate with this idea that first we need to focus those computers, and then secondarily we need to reboot them. And just the same way as we reboot a computer, to get rid of the remnants of whatever programs you're working with. And that's the idea of why you go to sleep at night. It gives an opportunity for your conscious and subconscious and so forth to kind of reboot into the thing. So if we look now at them as computers, and they actually broadcast a signal through the skull, that's alternating current signal that's picked up by an electroencephalograph machine that can measure both sides of the brain at the same time, so that you can see with this particular process what's happening in the left hemisphere, what's happening in the right hemisphere. And the processes that I use is to essentially put the left hemisphere asleep and to boost the right hemisphere through sensory imaging. And so that's what makes you more awake mentally while your body is essentially asleep, to where you can't even feel your body. And the number one reason, as far as I'm concerned, for doing that is for profound rest. And it's been proven starting back in the 70s by Herbert Benson back at Harvard Medical School that half hour of this focused state of attention, even in alpha, let alone in theta, is equivalent or better than 8 hours of sleep. So if we consider that rest, which is something that Americans somehow forgot about once they became adults or teenagers, the idea that we need to be unconsciously asleep a minimum of 8 hours. And if we're younger, it goes up to 9, 10, 11, 12 hours of unconsciousness. And to me, that gives a chance for these computers to reboot or to restart if you're a Mac person. So that's really why we go to sleep. I'm almost convinced that many people think we go to sleep because there's no longer good TV shows on, or I can't stay awake long enough to read a good book or whatever, so I just as well go to sleep. There's nothing else doing. Without realizing that I think you would agree that rest probably is the #1 thing that most of us need.
Oh, yeah,
and we need it every 24 hours. We don't need it to overdo it on Saturday and Sunday because we don't have to go to work.
Right.
So my push is rest. And rest, when it comes to healing the body and healing the mind, that level of rest, profound rest, where you might, let's say you have something going on in your body, cancer or some major disease process. My clients, I try to get them to do a half-hour session maybe 3 times a day. So essentially, and they're sleeping 8 hours on top of it. So now we're talking about in a 24-hour period, essentially resting the physical body and the mind almost all the time.
And this is by putting themselves through self-hypnosis into that theta state?
Into that theta state, that's correct.
Okay.
And I now call it, there's a terminology that the Eastern folks, the Hindu and Buddhists use called yoga nidra, which is a mental focusing that is very much like hypnosis, but exactly the same as what I teach, which is to keep the mind awake and active through imagery while the body goes into a deep state of relaxation. And the end result is tremendous degree of rest. And it's something that generally speaking, with few exceptions, can take care of an awful lot of things that's happening in the body.